Already this year in 2023, someone was found trying to smuggle over 19,800 fentanyl pills. It was on the Arizona and Mexico border where this happened. Now, let's go into some real quick background knowledge in regards to fentanyl. Fentanyl addiction and overdose is only on the rise, so let's first jump into some background info on what to know. Now, the majority, and this is some background in general, the majority of counterfeit pills look like oxy 30 milligrams. So the oxycodones, so essentially it's like the M30s. Those are the most commonly faked out there. Even in the psychiatric setting with patients, the Roxys, the Blues, that's sometimes what they go by as well. Very common, very, very common. Also, many counterfeit pills are made to look like opiates and opioids in general. Also, sometimes amphetamines as well. One thing you will notice as well is a lot of times with the counterfeit pills is that they will essentially look color and all legit, but it's really when you look at the writing of it. That's why you should always refer to like pill, there's Pill Wizard and whatnot when looking at your medications. It can be very, very, very sad and just a tragedy. Once again, somebody buys something off the streets, accidentally, it ends up being an M30. Oh, they just say it's an oxycodone 30 milligram. It's actually a laced one that they got from a friend. It's just, it happens more often than you think. Also, interesting enough, 4 of 10 pills with fentanyl contain a lethal dose. Think about that. Hear that again. 4 of 10 pills, and these are all found with fentanyl. So if something is laced and it's found with fentanyl, 4 out of 10 of these will be a lethal dose. And this number will only increase as well, which is sad. But that's some background knowledge in regards to fentanyl. Now let's talk about what to expect if you are currently using fentanyl. Let's look at some common knowledge you should know, and also what the detox is kind of like. Let's jump right on into this. Now, first and foremost, let's look at the most important of what you should know in regards to fentanyl, the overdose. Now, in regards to an overdose, remember when somebody first uses, the effect that leads to that euphoria where you continue to peak, and peak, that leads to that downward spiral of that nausea and vomiting, and where the pupils can potentially constrict, leading to a stupor and respiratory depression. Now, I say that because these are things that you should be looking out for. In particular, if you notice somebody nodding out, pupils constricted, and breath rate very slowed, you can't see the rise and fall of the chest, those right there are signs of an overdose. Once again, rise and fall of chest. Now, also, never be afraid to dial 911 in that situation. But the overdose is something that everyone should know, and also understanding what Narcan is. There's nasal Narcan. It's free in a lot of places. I don't know the status completely if you can just go get it at CVS for free for a friend. But this is, once again, don't be embarrassed if you need to get Narcan, because you are potentially saving your life or someone else's life. I personally always carry one Narcan because I see how much it is. I see how much people overdose in general, even with homeless people as well on the streets in general. It's always good to keep some Narcan with you. You never know if somebody will ever need it. No, I've never had to give it to somebody yet, but I have it just in case. So the overdose. Number 2, the physical withdrawal. Yes, there will be flu-like symptoms, the nausea, the vomiting, the diarrhea, you name it, it will be there. You can't get away from it. Now, depending on, as with other things that you can become addicted to, depending on the route that you've been using it, meaning if you've been smoking it, if you've been using it via rectally, got some videos on that. I'll put a link to some of those, rectal use, in particular methamphetamine. But also, if you're shooting up, typically will depend on the severity. So if you start, if you're shooting up, if you're shooting fentanyl and you're coming off of it, yes, your physical detox is going to be a lot harder. But one thing I can say, which I'll get to a little later, is typically it's not life-threatening in regard. It's non-life threatening when you're going through the physical detox when compared to something like benzos. But I'll talk about that in a minute. Now, number 3 important fact to know about fentanyl is, yes, the post-acute withdrawal effect as well comes into effect. So depending on how much you've been using, the route again will depend on your cravings. And cravings aren't something that, just because, let's say, some people, the mental cravings won't be as bad, but some people who have, for example, have a family history of this. Sometimes people who have family histories of addictions, the mental cravings are a lot harder for those individuals. But that's not everyone, but you always have to keep that into consideration, that the mental cravings will always vary on a spectrum, and it's on a case-by-case basis. And this is something that, for me, in general, or from what I've seen even with patients, it's completely subjective. So I don't even like to say, oh, if somebody's been shooting it up compared to somebody who's been just smoking it, oh, the shooting up, that one, it'll be a lot worse for them long-term compared to the other one. No, with that, I won't ever just jump to a conclusion. I'll just put it that way. I know I went on a little tangent with that, but that's the truth. But yes, the mental cravings. And lastly with this, I just briefly want... Now finally, sorry, my camera cut out. If you see somebody physically detoxing from fentanyl, or you notice these signs and symptoms, typically if they are going through the physical detox of this and they have not used, it is not life-threatening for them. Compared to something like benzos, if somebody's been using benzos, long-term chronic use, Xanax, Klonopin, Valium, you name it, those you can have seizures. They're induced by benzos, things like this. But with opiates and opioids, more so just harsh flu-like symptoms. That's why if you are going through the physical detox, have faith. It's going to get better for you. It's going to get better. You just have to endure. It's tough, but you have to endure. And obviously there are interventions that can be made once you haven't used for about 72 hours or maybe even a little bit longer, to use things if you need to, such as Suboxone, Subutex, things like this. But number 4, the physical detox of being non-life threatening. I say this to also just let you know, if you ever see someone who's going through this, you can assure them, well, once again, you can help them by telling them, help them and inspire them to get clean by knowing that, it's not life-threatening. Yes, it's tough right now what you're going through, but it will get better. So to anyone out there, that's why that's number 4, why it's the non-life-threatening aspect of it. Once again, I do this video because this is all things mental health, and this is your daily dose of mental health. And we're just going to be putting things out there all about mental health, different types of videos like this. Once again, the history of methamphetamine will be coming out soon. Also, check out my 365 days of running. I am actually getting close. I'm past day 300 right now, and I'm continuing to do that. I've been lifting a lot more as well. but check that out. And once again, thank you to all the new subscribers. Welcome to all the new ones. Leave a comment. I read them all. Like and subscribe. I'm out. Once again, this is your daily dose of mental health with Adam. Peace.